Hi, how are you doing today?
I'm good. How are you?
Good. So, based on our previous assessments, I have come to the conclusion that you are at risk for hypertension, diabetes, which you currently have, and then obesity. And they all kind of tie in together. And so, how do you feel about those? Do you feel like you're at risk for those, or?
Unfortunately, yes.
Yeah.
Yeah.
So, but we're in luck. There are things that you can do to kind of prevent those things from progressing and happening. So I have made a teaching aid for you on hypertension, which is the...
Now, tell me what that is.
That's high blood pressure.
Okay.
So anything, and based on the age, which is high blood pressure, which the American Heart Association says that is that your top number when you take your blood pressure readings, if you've ever taken your blood pressure, would be between 120 and 129. That's what they're saying is high. And then based on that, they go into hypertension stage 1, which is 130 to 139 for the top number. And then hypertension stage 2 is greater than 140 consistently.
Oh.
And so we don't want to go up there. We want to stay below 120. So I made some slides on things that you can do to prevent the hypertension from progressing.
Okay.
Your modifiable risk factors, which means they're risk factors that you can change and that you have the ability to control. Those include obesity, so weight, excessive sodium, so things like, lunch meat and soup, like canned soups and all, have lots of salt in them.
Okay.
And if you use a lot of salt in your food, that can also progress to hypertension as well, because it adds to your heart, the fluid in your heart.
Well, that's one positive thing I have. I don't like salt.
Oh, good. That's perfect. Reduce the risk factors of hypertension is by eating foods that are high in potassium, because a low potassium or a high potassium can cause hypertension and heart failure. So having foods that are high potassium to keep your level normal is good. So foods that are high in potassium are things like bananas and leafy greens.
Okay.
Those are both very high in potassium.
Okay.
Okay. Having a sedentary lifestyle can also cause you to develop hypertension. Sedentary means that you're just, you don't do much, you don't exercise. Do you feel like you exercise?
When I have the grandkids.
Yes, of course. Of course. Things like stress can cause you to have hypertension. Do you feel like you have a stressful lifestyle?
Yeah.
Yeah, for sure. So, managing that stress is something that can help with the high blood pressure as well.
Okay.
And excessive use of NSAIDs, which are things like ibuprofen, Motrin, and Advil. Those are things that can cause you to have high blood pressure as well. And do you use a lot of ibuprofen or Motrin, Advil?
Well, it depends on what you consider a lot. I would say maybe once a week.
Maybe once a week?
I
Okay.
take 3 ibuprofen.
Okay.
But when I take ibuprofen, I usually take 3 at a time.
Okay. All right. So a diet that you can kind of take on, which is, relatively easy to take on, but sometimes can be hard to follow. It's called the DASH diet in short.
Okay.
So you're going to eat things a lot of vegetables, fruits, and whole grains, and a lot less of caffeine, sweets, and sugars.
But doesn't a lot of fruit have sugars in it?
It does, but in moderation, and with the vegetables and whole grains also. Okay.
All right.
Like we talked about, exercise can be something that would help your high blood pressure as well. So they recommend at least 150 minutes of exercise per week. So if you can't meet that right away, it's okay. But 30 minutes of walking or jogging or things that are aerobic exercises, which are things like swimming, cycling, jogging, walking, running, things like that can help you. Okay.
All right.
All right. And as far as taking your blood pressure, do you know how to take your blood pressure on your own with an automatic cuff?
I do.
Okay, good. So they want you to take it when you wake up in the morning and then before you go to bed in the evening. That's kind of what they like you to do to see how your blood pressure is ranged throughout the day.
Okay.
And it's good to keep a log of them. So to write them down as you're taking them, so you can kind of see day to day how your blood pressures run.
So not during the day?
Once during the day would help too.
Okay.
So yeah, maybe around lunchtime. So in the morning. And if you take any blood pressure pills currently?
No.
No? Okay. All right, good. All right, and just when you take your blood pressure, be sure to have your legs uncrossed and flat on the floor. You have your arm, the cuff right in line with your heart, and that's the way to do it. And just make sure that you kind of stop talking and stop moving around about 5 minutes before you take your blood pressure.
All right.
That way there's not any false readings of high blood pressure.
Okay.
Okay?
All right.
And then when to seek medical attention is also something that we need to talk about. An hypertensive urgency is a systolic blood pressure, which is the top number, which is greater than 180. So if you ever see your blood pressure greater than 180, it's good to seek medical attention right away.
Okay.
Or if you get shortness of breath or chest pain, numbness or weakness, or difficulty speaking or severe headache or anything like that, that's when you should seek medical attention.
Okay.
Do you have any questions?
I don't think so.
Okay.
Thank you very much
You're
for all
welcome.
your help.
Of course, no problem. I wish you the best, okay?
Thank you.
Okay.